Small town, Northern Ontario, is dying.
Our healthcare system is broken big time.
Here's my hand. Okay, all set. There we go. Good job.
I wouldn't want to live here without a hospital here. I have to send the only ambulance in my town out of town.
I don't feel that what we're doing right now is sustainable.
You really did clunk your head. You're going to be very sore.
Right now we're in a crisis.
Our inability to operate puts people's lives at risk.
We've been hearing a lot about the problems faced by northern and rural hospitals across Ontario, and we decided we're going to take a closer look. We've just arrived in Sault Ste. Marie, and we've been invited to follow along healthcare workers in this region to see how they're facing the challenges and how they keep their hospitals open to their communities. Our first stop is the hospital in Blind River. The hospital here is part of the North Shore Health Network, 3 hospitals on the north shore of Lake Huron along the Trans-Canada Highway.
And then you are going to need stitches.
I want stitches. I know.
Dr. Deanna Hagan is on duty in emergency and one of the few local doctors serving this hospital. They used to have 6 doctors help fill the shifts at the emergency department, but at the end of June, 2 local doctors left the region. A third is pulling back from the hospital to focus on primary care.
Do you want mom and dad to sit with you? I think the thing that actually keeps me up at night is like, how do we keep up this pace in the long term? And if we can't, what happens? We're gonna stay really still, okay? 1, 2.
With half the local hospital doctors leaving, they depend more and more on temporary doctors called locums. Most fly in for shifts.
We're one missed plane ride away from a possible closure, which is a fragility that urban places don't experience to the same extent. This is our triage space.
Tim Vine is CEO here. He says Blind River hasn't had to shut down yet. But we drove 45 minutes down the road to the hospital in Thessalon, where 4 times last summer the ER shut down over 24 hours. The hospital has had shorter closures since.
What happened?
I was driving down the highway and the whole right side of my truck just locked up and I had no control and it threw me right into the ditch.
The hospital is right off the Trans-Canada Highway.
So Shaw, on the whole, is very lucky. He's going to be very sore today and worse tomorrow. So we'll go give them the good news.
Dr. Amy Vine is making decisions each shift to make sure the doors stay open.
I'm not a radiologist, but to my eye, the x-rays look good. We do the very best with what we have. We have very highly skilled staff, and we make it work. And we've improved a lot of people's health and saved a lot of people's lives by being here. Hi, I'm Dr. Vine. How are you today?
Amy Vine is one of those rare commodities in rural Ontario, a doctor from the region who decided to stay. Across the province, pandemic delays accessing care and the lack of family doctors means sicker patients more often.
You sure no goop came out?
Nothing.
Yeah.
And sometimes they get slammed, like last night.
And I think we had 5 ambulances in total. Yeah, like it was crazy.
So what happened today?
We spent hours on an ER shift with Dr. Vine.
So we just saw an 81-year-old female who had a fall in her trailer.
The hospital does have an x-ray machine, and the x-ray can tell if bones are broken.
And she is complaining of some right leg pain, but can't tell me where in her leg exactly it hurts. Can I look at the pelvis on your screen? Wow.
And it's, we put ice on it.
You really did clunk your head.
But there is no CT scan to check what's happening in the brain.
Some people in her age group, we would do a CT scan of their head to make sure that they don't have bleeding in their brain. And so this will be a discussion between her husband and I whether we think that's necessary.
No CT scan means Dr. Vine has to decide whether to send the patient away to hospitals in Sault Ste. Marie or Elliott Lake. Both are more than 45 minutes away. There's just one problem. A nurse would have to go with her.
The whole system is very precariously balanced and the resources are very thin. If the nurse has to go in the ambulance, then we have to close as well because the RN is gone.
Shutting down the community's only ER to accommodate one patient's CT scan. It happens for a few hours, a couple of times each month here. And it can also leave the community without an ambulance, a situation that can lead to what they call code black.
It has been an increase simply because we're doing a lot more transfers than we typically do. And we do find some hospitals are a little more difficult to understand the situation that we're in. So that is the area we cover. About 45,000 square kilometers is what we cover.
There's one ambulance on duty in Thessalon, too, in Blind River during the day, and they are busy. Not just for 911 calls. More than 2/3 of the calls are leaving just to transport patients to tests and specialists not available at these small hospitals.
You okay jumping back with her?
We took a ride to see what the paramedics are facing in this region each day. And the first call took this ambulance out of the region for 2 hours to transfer a patient for a test that couldn't be done in Blind River.
No recent fevers, no new worse than normal.
And there's a staffing shortage for paramedics here too.
My last set, I did 60 hours of overtime. 60 hours of overtime in one set in 2 weeks. It's just like, that's crazy. If you go to a workplace and you're always pressed to do more than, you know, you're constantly asked to do more. You're constantly asked to take more shifts, work longer hours, and that's every day. After a certain point, you look for a place with greener grass. You move on, right?
It's definitely a crisis time right now, trying to balance everything to try and get everybody the proper coverage they deserve.
We are hoping there is nothing wrong and the exam at this point is normal. We watch her and see how she does. If her condition deteriorates, then we consider the CT scan. Is that the way you want to go?
Well, then we'll go from there then.
No CT scan and an ER closure is averted for now. Before the pandemic, this was one of 4 inpatient beds at the Thessalon Hospital. And now, since the pandemic began, they have been incorporated to expand the emergency department.
This was an inpatient room, that was an inpatient room.
They're using the space to beef up the service for the growing number of patients turning up at the ER each day.
Like now we have access to ultrasound. This is a smaller exam room. This used to be our linen closet.
Those inpatient beds also required staff the hospital just doesn't have.
Yeah, the ER wait times would be astronomical if we tried to have inpatients here now because we use this space every day.
But for people in the community, the loss of the inpatient beds is a sign that their hospital is in trouble. For them, the hospital saves lives, including Kathy Marshall's. When a flu last year took a dangerous turn, she couldn't breathe.
My first stop was here. I would not have made it without this. And I can honestly say I'm here today because of this hospital.
These women have been collecting stories from the community about why the hospital is so important.
Northern Ontario, small town Northern Ontario, is dying. We're becoming ghost towns. Like my husband says, we got to move out of town. If we can't get a doctor and if we can't, get to appointments, we got to move.
This is not the only community fighting to keep their hospital open. The North Shore Health Network has 3 sites strung along the north shore of Lake Huron. This site at Richards Landing was threatened with closure more than a decade ago, but the community rallied and fought back.
And it raised a lot of public anger, and we had a number of public meetings.
The mayor says in the end they saved the ER, but they never let their guard down.
Rural Ontario can be killed. They can be starved. And we see that with services such as a hospital, doctor services, school. If you take those services away, then it impacts the viability of your community and the future of your community.
But staffing troubles plague this hospital just as it does across the region.
Your first stitch is done.
Back in Blind River, Dr. Hagan is almost done sewing up a knee.
Any guess on how many stitches?
5.
6. And so mom and dad are gonna watch to see if it gets red or pus starts coming out of it and all of that kind of stuff, okay? And if that happens, you have to come back.
Oh, I don't want to come back to the worst place ever.
It's not the worst place ever. Carolyn, are you the boss? I have an admission.
Oh, okay.
Sorry, this is Ryan from the CBC.
Nice to meet you.
There are inpatient beds here. Its emergency is busy. Today, they're short a nurse.
She's got coronary artery disease, awaiting bypass and aortic valve replacement, but they keep putting her off because they're not sure they can do it.
Oh, nice.
And she's only like 50. Yeah. This lady has a pretty complex cardiac history, She's awaiting open heart surgery in Southern Ontario, but she's in with chest pain and trouble breathing today.
It's like putting together the pieces of a puzzle.
Okay, sorry, I'm just gonna go look at her ECG here. If they
Dr. Hagen now needs the results from a blood test called an INR. It's a blood test for patients on blood thinners, but there's a new challenge.
Our machine is down for maintenance today, and I was told it would be 5 or 6 hours. So far we haven't needed anything urgently, but in this case, because she is on blood thinners for her heart right now, we want the test more quickly, but it'll probably have to be sent out.
They can't wait. They have to send the patient's blood to another hospital for testing. When Dr. Hagen started her career, the pandemic had just begun. It was trial by fire.
We'll see how things are going after the x-rays, okay?
And like Dr. Amy Vine, she is one of those rare doctors who decided to come back home to work in this region.
2 patients that have tested positive for COVID. I don't know if you do COVID rooms.
But coming home has come with a cost. The hospital doesn't have the resources of the larger hospitals where she trained, and more doctors are leaving.
We do have quite a few empty or unfilled shifts. So this is for all 3 sites.
Yeah.
All the yellow are unfilled shifts.
She's worked shifts that have extended to 32 hours to keep the ER open.
It's not sustainable for me. Definitely it impacts like my relationships, my home life, that kind of thing. It definitely puts strain there. I'm just a regular human being. And if you say no, I can't work that day and the emergency department closes.
Yeah. The stuff she loves, working in the region she grew up, taking care of folks in her community.
When they come in, you have a nice visit with them while you sort out whatever issue they have that day. And it's kind of what makes Emerge here fun. The good news is you got no bleeding in your brain. You still got a brain. Okay, I'm sorry about pulling your hair here, okay? Yeah, this is like the saga of today. So I have her, and then I also have another lady who has a mechanical valve here with a very complex cardiac history, and our INR machine's gonna be down for probably another 3.5 hours right now.
She says they're lucky to have people like Chief of Staff Dr. Nick Jeeves, who has more than 3 decades experience in rural medicine.
That was her coming in with like terrible chest pain, clutching her chest, 3 sprays of nitro.
But Dr. Jeeves is on track to retire over the next 2 years. That would leave Deanna Hagen and one other as the last 2 full-time local doctors. The reliance on fly-in, fly-out locum doctors will increase, and long shifts will continue.
We're hanging on by a thread right now, like we're just kind of keeping the doors open. It would take not much to kind of be the straw to break the camel's back right now. I think what we're doing right now is not sustainable in the long run.
What would break the camel's back?
Honestly, if one person got sick, there aren't the bodies to fill the shift right now. It could result in a closure very easily.
Money is always an issue. They spent almost $1 million last year on pricey agency nurses to keep the hospitals going. The province has been offering special funding for the fly-in doctors, but the money is not long-term. And then there's the budget. Funding from the province fell short, keeping up with inflation.
The board is going to have some tough conversations.
The hospital's last couple of budgets have depended on last-minute bailouts from the province. Now, even if North Shore Health Network stabilizes the doctor and nursing shortage, the CEO says the chronic budget shortfall could still force hard decisions. Should Thessalon stay open?
I've got my answer, and it's an unequivocal yes. But if that's to be the case, we need to be funded in order to deliver that service, and we currently aren't. Now, I don't want to overstate things, but our inability to operate puts people's lives at risk. I don't think that should be, that should be relatively uncontroversial to say, because we're in the life-saving business, and if we're not there, there will almost certainly be deaths that would have been avoidable had we been there.
Hard.
Until the money issue is resolved, the future of the Emerge in places like Thessalon is not secure.
What happens if this hospital cannot keep its emergency room? What happens to this community?
Bad things. People will be sick, people will die. Like, the closest hospital from here is 40 minutes away. So that means that I had a patient on Sunday who had an anaphylactic reaction to a bee sting, and she was minutes from collapse. Her vitals were very abnormal. If she wouldn't have gotten care in that first 5 to 10 minutes of arrival of this hospital, her fate may have been very different.